Well, what is chiropractic care at Gunderson Health System? We're going to find out with the chiropractor. Dr. Josh Petrosky is here to talk a little bit about that. What is chiropractic care at Gunderson? Because I don't know that every health system has chiropractic care.
No, actually chiropractic care at Gunderson is very unique. It's actually very innovative as well, the way we've been implemented. We're part of the physical medicine department, also integrative medicine department. And so we see patients primarily with back, neck, rib pain, things of that nature, musculoskeletal type pain. We really are incorporated into a patient's medical care. So we work a lot with their medical doctors or physical therapists, and so very unique. And really the goal is to have us be the portal of entry into the Gunderson system for back and neck pain, because we're low cost and for the most part high value for a lot of patients.
So where are you located at then? Because you are working right with other physicians, as you mentioned. Where's your physical location?
Sure. So there's 3 of us chiropractors currently at Gunderson. We see patients in physical medicine, which is in the East Building in La Crosse. Integrative medicine is in on the 2nd floor in the Unalaska Clinic. So both those locations.
Big question is, who is the right patient for chiropractic care?
Sure. So a lot of patients that are unsure of what to do, we're a great starting point for them, as opposed to going into primary care or anything like that. If it's back pain, neck pain, and they don't really know what to do, there's a great resource that we send patients to. It's a self-help tool that we have on the Gunderson website, and I believe we'll be able to provide maybe a link to that.
Self-help tool.
And so that really, especially for what we call non-specific back pain, so back pain that doesn't shoot down the legs or is not overly traumatic in onset, where all of a sudden you just have this back pain that won't go away. It gives a lot of tools for patients to help self-manage or get themselves better. Majority of back pain will get better if you just kind of go about it and can tolerate the discomfort. The 2 things that need to happen is, 1, you need to maintain some sort of activity level so the back can get better without kind of pushing that line and getting things more uncomfortable. The other thing is an opportunity to do that. So a lot of us, maybe with little kids or with jobs, our back really doesn't get that time to recover, and so oftentimes our role is just to expedite that process. But the self-help tool will go through some exercises, stretches, some recommendations for your daily activities to see if you can get yourself better. And if you can't, then that's a great patient to come to us. We can evaluate them whether chiropractic care is the right place for them to be. If not, we can work with medical providers, even our physical therapists, which are wonderful, to really get them the proper care that's going to get the most efficient results as quickly as possible and really get them out of our office and back onto enjoying life.
That self-help tool is available on the Gunderson Health System website and different social media formats, so make sure you look for that. Big question though is, a lot of people wonder, do I need a referral?
So patients do not need a referral. We have a lot of patients that will call and get on our schedules that way. A lot of our patients do come from referral from their various medical providers, but they definitely do not need a referral.
All right, insurance is the other question that people have when it comes to chiropractic care. How does it work with a chiropractor at Gunderson Health System?
So Gunderson, we as chiropractors, we're covered under most insurance plans. So if a patient calls and tries to get onto our schedule, we have a great, wonderful support staff that will go through those things, and if they're not, the patient is made aware of that beforehand. But really, it's not something we run into too often.
We're talking with Dr. Josh Petrosky and about chiropractic care at Gunderson Health System. You kind of mentioned some of the physical locations that you see patients. I think it might be worth reiterating where you see patients within Gunderson.
So 2nd floor of the Unalaska Clinic is where integrative medicine lies, and there we also have great providers. We have massage therapy, acupuncture, functional medicine with some of our medical providers. So that is one location. The other location is in La Crosse on the 3rd floor of the East Building. That's where physical medicine and neuroscience is, and that's the department that we're part of.
What should patients expect when they see a chiropractor at Gunderson?
Sure. So it really depends on the specific patient. We really customize what a patient experiences based on what they express to us, what their goals are to get out of treatment. So basic sort of things, you'll get an evaluation, we'll take a thorough history, we'll get to know our patients. That's the most important part, to see where maybe the pain is coming from, how it happened, and then route them appropriately. Oftentimes we do a great job of getting patients better without needing to involve outside providers in the system. However, we have great providers that we need to collaborate often with, especially with our more complex sort of back patients that come in. And so it's not uncommon for us to be chatting about patients in the hallways with our physical medicine physician physicians, or even just on the phone going back and forth with our physical therapy colleagues.
Can you give an example of how that collaboration works? Because that's a real key for a lot of patients, because they want to have that team approach.
Sure. So a great example of that would be if you were to come to me for low back pain. And really, I tell patients all the time, my goal is to become as useless to you as quickly as possible, meaning I want you better, and you're better not to be dependent on me. So oftentimes as chiropractors, what we see is that maybe we can get a patient better, but they're not staying better without needing to come back to us on a frequent sort of basis. And so if our goal is truly to get a patient out of our doors and functioning in the community and doing great, caring for their family, doing all the fun stuff, then we sometimes need to add something. And physical therapy has been great for us to work with, where oftentimes they can take that improvement that we get and help that patient maintain it, both with home exercise program and even just with the visits with our physical therapy colleagues. So that's been a great sort of interaction. The other thing is, if you came to me and I can't even get you on a treatment table because your pain is really through the roof, so the tools that I have in my toolbox may not be appropriate for you at that phase of care, our physical medicine docs, or having you seen in our spine center, which we're also part of, getting maybe some medication that you may need or something like that, where we can initiate treatment sooner, has been very valuable to patient outcomes.
And that team approach is really different because you're part of a health system.
Absolutely. And so we have access to all of our patients' medical records, all of their imaging historically, MRIs, CTs, X-rays, and that information really provides a big benefit and advantage that we have here.
Seems like a great benefit to the patient, that's for sure.
It incredibly is.
I do want to give you one more opportunity. You mentioned the self-help tool, but I want you to say why that's so important for patients to maybe a starting point.
Sure. So it's empowering for a patient to have some tools, and especially when pain, a lot of patients, maybe the pain is in early in the morning and they can't sneak in to, for us to evaluate them when their pain is at the worst, but at least they have something that they can start to do. Oftentimes when they come see us, we're not the ones dragging them through towards improvement. We want the patients to be actively involved in coursing themselves towards some improvement. So we walk alongside a lot of our patients, and sometimes we help push them in the right direction with manipulation or the care that we provide. But oftentimes it's just educating and encouraging them to, put the tools around them or put the time around themselves to take care of themselves to get them better. Because oftentimes that's all that needs to happen.
All right, look for a link to that self-help tool. Josh Petrosky, chiropractor at Gunderson Health System. Thanks for joining us.
Perfect. Appreciate it.
If you'd like to learn more about chiropractic care at Gunderson, you can simply go to the Gunderson Health System website or check us out on social media platforms.